Thanks for joining us on this Sea Ranch Life. Today, our guest is Ara Chakrabarti. Ara is the CEO of Redwood Coast Medical Services, our local community hospital and health clinic. Ara, thanks. Welcome to the show, and thanks for joining us.
Thank you. Thank you for having me.
Let's bring everyone up to date a little bit on sort of current status at RCMS, and then we'll dive into kind of the main part of the program. But can you give us an update? There's maybe three areas that occur to me, and maybe you have others. Talk about healthcare delivery in general. Our primary care and urgent care and the dental services, all those. And tell us a little bit about staffing. That sounds like that's a constant challenge. Staffing, and then give us a little picture of the financial status of RCMS, if you would.
Great. I think those are absolutely the key pillars of how we organize and manage the RCMS. The reason for existence is, of course, providing healthcare to the community. And improving the healthcare outcome. So, as you said, we provide the primary care, dental care, behavioral health, but we do other things that is not always, easily found by people that are coming or not known. Such as we provide chronic disease management, women's health, family planning, pediatric care, and we also are looking at continue to provide more specialists. Currently, we have an orthopedic surgeon who comes every 6 weeks. We have a pulmonologist who comes every 6 to 8 weeks. We are trying to work with an oncologist to bring her in on a regular basis. And of course, we provide dental surgery as well. So these are the areas that we provide services. A couple of those areas I would like to make some comments. One is this palliative care and end of life, home health, elderly care. We have been providing that for many years, like hospice like service in RCMS, but it was never recognized by the state of California or Medi-Cal that we're an approved provider of palliative care. About 3 months back, after a lot of work, we got approval from the state that we are an approved palliative care provider. So end of life, home health, elderly patients released from hospital at home, so we can provide those care and coordinate with the hospitals. So that's, we have always been doing it, but now we are formalized by the state. Regarding some of the specialists, we are trying to look at to get other specialists in here. And the rationale for that, George, is that we don't want our community members to drive to Santa Rosa or Fort Bragg to see someone, once every 3 months or something. If we can have the specialists come here, and if they're our primary care patients, then we can, incorporate all that. So we're trying to see if we can get a geriatric specialist and a ophthalmology specialist, et cetera, continue to, either difficult to do those because the specialists are busy and in a short supply, but we're trying to coordinate that. A few other kind of data points maybe helpful for your audience. We have about 5,000 named patients in our system. Out of a population of about 8 to 10,000, depending on how you count and what area you count. And we get to see about we have about 15,000 visits in a year. So most of those patients we get to see at least once. Some of them, of course, we see multiple times. So that's our primary patient pool and our services that we provide. Let me talk a little bit about our urgent care. Our urgent care is quite unique in the sense that we are the only clinic of our size and category that are allowed to receive emergency medical transport, otherwise known as ambulances, in our facility. The requirement for receiving ambulance in a healthcare facility is that they must be tied to a hospital which has an emergency room.
Mm-hmm.
Given our geographic situation where we are isolated, the nearest hospital is 2 hours. We have a special provision, that's a special law in the state of California that was approved a number of years back. RCMS can receive emergency medical transport. We're the only one in the state of California, and I am not aware of any other clinic of our size and capability can receive emergency medical transport in the country. There may
Wow.
be one or two, because it always has to be attached to a hospital. We are 2
Right.
hours from a hospital. Okay.
Yeah.
What that means is that we need to have an urgent care or emergency room facility that can handle trauma patients. Whether that trauma is a head injury, collapsed lung, progressive heart attack, or a profusely bleeding gunshot wounds. And all
Mm-hmm.
those have happened here within the last few years. That means that we get special training for our providers who can treat emergency room patients like emergency room patients. We have to have tools and technology and process and procedures that is approved by DHCS, the California Authority on Providing Medical Services, that we are capable of doing those. So we do that all the time. And we see somewhere between, I would say, about 3,000 to 4,000 emergency room visits in our clinic every year. Sometimes it's more, so 500, sometimes 500 to 600 a month, sometimes a little less. And those patients that we see, in a large percentage of those will have to go to a hospital if we are not here. So that's kind of the uniqueness of us, special recognition, a special law in the state that allows us to do that, but it requires us. So we get inspected annually by the Emergency Medical Care Authority of State of California, that we have emergency room-like capabilities, not only people, but process procedures. So that's something is
Wow.
important to understand.
Yeah. Ara, let's jump over, if we can, for a second. You've just described a lot of services that really, a small isolated hospital. It sounds like a long list of services that you all provide, probably more than many people would know. Is this part of what has prompted you and the board to consider physically expanding RCMS, and talk to us about this proposed expansion?
So the reason for the expansion is multifaceted. The building that we are in today was built in 1985. And it was not necessarily built for a medical service delivery type of organization. No, of course, it was retrofitted to provide that, and that's where we are. What we realized that the medical services or healthcare services delivery of tomorrow, and that's not tomorrow, but 5 years, 10 years down the
In the,
line.
yeah, in the future.
In the future, is not this building is not conducive to provide that. We cannot deploy latest tools, technology, or processes needed in a modern clinic or a modern hospital.
Right.
The facility is inadequate to provide this clinical care needs of tomorrow. The patient flow is not appropriate. We cannot separate them appropriately. Our lab, which is a moderately complex lab, so not a hospital grade lab, but just one step below, federally controlled and regulated lab we have. It's in a tight space, so we need more space. So our urgent care needs more beds. So given all that, and the fact, which is an important fact for people to understand, that there is no other alternative to RCMS.
Right.
The economics do not work here to have another clinic or a hospital or a field hospital to be set up or developed here. That's a sad story, but the
Yeah.
economics don't work. I've tried everything to look at it. So I think that's the primary reason that if we are going to be here, and RCMS is an absolute critical element for this community to be what the community is for an extended period of time, then we need to have a facility that can provide the healthcare of tomorrow. And this one current facility is not adequate, not conducive. That's the primary reason of doing that expansion.
Right. Ara, does that mean the existing building is the plan? Would it continue in use
Yes.
for certain functions? So you're building an addition and also will continue to use the existing building.
Correct. The right term probably is that we're building an annex to the
Okay.
existing building,
Okay.
and it will add more space, more clinical space. The right now the plan is to add about 2,500 clinical space connected. It'll be just adjacent to the service annex, so it'll be just hallway going into the new facility, and then another about 2,400, 2,500 space. It'll be 2 floors. That will be empty shell space. So
Okay.
once the facility is completed, the new annex will add about 50% more clinical facility in the main building, and have another ability to add another 2,000 to 2,400 space down the line for various activities, whether it's conference room, administrative area, or maybe some clinical space.
Right. Right. Will it let you? Will the new building, the new annex, we'll call it, will that house an expanded laboratory area, or will you expand the current? How will you handle that laboratory
So I think
situation?
the primary plan right now is to move our primary care into the new annex.
Okay.
So most of the primary care will move to the new annex. Some of it will stay in the existing building as well. That will give us space to expand the lab, because some of the primary care will move, as well as reconfigure the urgent care with a new entrance, new waiting area. Right now, the urgent care patients and primary care patients all are in the same waiting room. We want to separate those. So the new annex will mostly hold some staff, like the new nurses hub, as well as the primary care facility. The front desk, the front entrance to the primary care will be on the new annex. And the existing building will have an extended lab, extended urgent care, and some primary care activity as well.
Okay, great. As you and your team are considering this, I think we're all aware that the cost of construction here on the coast, number one, the cost of construction in California is higher than most everywhere else in the country, and certainly the cost of construction, we see that every day when we see there's new houses and or remodeled houses going up. We see them all the time up and down the coast, and the cost of that has gone up. Things were exacerbated by the pandemic, and we have a limited pool of contractors and builders here, everything. So that leads to the question. This new building, which is around total around 5,000 square feet, something
Right.
like that. What's it going to cost to do this project? I know that's a little bit pie in the sky, but what number? Where are you at right now? What do you think it's going to cost?
So I think we're still kind of in the process of putting all the numbers together, but we do have some ballpark estimation. I think it's going to be right now we think is somewhere in the range of 6 million, $6+ million kind of range that we are looking at, and that's of course based on the information we have collected so far for the
Sure.
construction, planning, etc.,
Right.
architectural.
Right. Does that number also include, there's quite a bit of specialized, the hospital has special medical equipment that you just don't buy at the hardware store.
Right.
And what architects refer to as furniture, fixtures, and equipment. Does that number include things like medical equipment and all the technology that you're going to need?
It mostly, and that's why the number is still kind of soft. I think we are
Okay.
6+ something, but that's kind of yes. But yeah, we want to have those equipped so that we can provide the services. It's not empty rooms.
Right. Right. Absolutely. Um, I understand that your board has retained a consultant to assist you with the capital campaign. Capital campaign, of course, is the effort where you go out and try and raise this money, this $6 million plus. Tell us a little bit about why you chose to work with a consultant and this consultant in general, and if you can give us any clues about what the capital campaign might look like, how
Sure.
you're going to roll it out.
Sure. So I think the first point, we realize that while we have been successful in raising funds every year for RCMS, small, about $500,000 in that range we do. Uh, we are not quite capable of taking on a capital campaign of that nature because that's a significant amount of raise we have to do. So we needed professionals whose jobs are doing this kind of major capital campaign. So we talked to a number of those kind of organizations, and then we narrowed down and we selected an organization that they are called DeVos Institute of Arts Management at the University of Maryland. So they are located at the Maryland University, and it was set up by some funding from the DeVos Institute originally, but is an independent entity. And they are, they provide major capital campaign activities for various organizations. Originally, they started with providing capital campaign activities for arts-related initiatives,
Yeah, like
but they have
museums and
museums,
universities, that kind of thing.
Kennedy
Yeah,
Center,
yeah,
National Museum of Modern Arts. I've got a list of here, Philadelphia Mural Arts Program, and some of these are capital campaigns are from few millions, $2-3 million to
yeah,
some hundreds of $1 million.
right.
So we referred to them from some of our people here locally and board members, and that's how we got them engaged with us.
Right. What's this capital time wise? What do you think it's going to take to raise this? What will be the duration of the capital campaign?
So yeah, I think and there are various elements of this. Our
Sure.
fundraising, capital campaign is one element. We are looking at low interest loan, et cetera, because we are
Right.
a healthcare providing entity. So there are some other alternatives that also complements and supplements our plan.
Yeah.
So right now we are looking from a timing perspective. We are expecting to have a formalized or somewhat formalized capital campaign plan that we will kick off later this year, probably most likely January, February timeframe.
Okay.
So the next 6 months we'll be working on putting it together. We might have some initial activity reaching out to some donor groups, not necessarily individual donors, but foundations and philanthropic organizations outside of this area. But it will get into full swing probably sometimes in January, February timeframe.
Okay. Okay. And that's while you're $6 million, as you're mentioning, there's capital campaigns that are much larger, and there's capital campaigns that are smaller. And I think anyone who's been involved in a capital campaign realizes there's a set of skills and a knowledge base to be effective at doing this. It's really not an area you can just sort of learn by trial and error. You can't practice it for a few years because you've actually got to accomplish something by raising the money, because every year that ticks by, the budget, the cost of doing the project increases. So you don't want to think outside the box too long. If you were, this is a little bit, this one's really pie in the sky, but I'll throw it out to you. Throw it out to you anyway. If you're able to raise the money, and let's say it's just for sake of discussion, maybe it's 2 years, a 2-year program, or maybe 3 or something. But how long? When would you like to have this facility? I mean, realistically, the capital campaign, design and construction takes a certain amount of time to do. What's maybe an optimistic or an ideal time when this facility would come online? And this is just your wish list. This is no
Yeah. I mean,
guarantees here.
obviously, we have a plan in place. We
Yeah.
have. I mean, it could change. So that starts from the architectural design, which is we've been working on it for the last 12 months, almost 18 months. We have architects engaged for a number of months. So anyway, that plan is pretty much done. We are in the process of now getting the approval from the county. We have had already a number of discussions with them. We went to the archaeological, we are required to do an archaeological study because of the location and the history of this area. So we are in that process now. If those things are all done, we hope that sometimes by early next year, then, and if the capital campaign starts kicking in a little bit, we have seed funded it to some extent, and that we are able to do. We would like to start the construction probably summer of 2025. The initial, that is to start digging the place and all that. And it's a process of about a year and a half from the time we start. So towards the end of 2026. From the time we actually put the shovel in the ground, first shovel in the ground, about 18 months. So if we can start in summer of next year, then by end of 26, we may be able to do that. Now, there are many if and, do we have the money and all that kind of stuff, it needs to work through that. We don't need all the money up front, right? I mean, because as a construction, so if we get a construction loan, we can start doing that. And as we have the fundraising activity, we can pay it off and all that. So we have a comprehensive plan we have put together, but that's kind of the time frame you're looking at.
Yeah, wonderful. Well, that's to me, that sounds ambitious, but that's okay. I think it's better to start out ambitious. As you stated, there's a number of contingencies that could occur. You can't predict everything that's going to happen, but you have to make a go of it. Ara, I'm going to remind everyone, if they're interested in contributing to this effort, I believe one easy way is to go to the RCMS website
Absolutely.
is a very easy way. And we'll just say if there's a larger donor out there or several larger donors who want to make a sizable gift, um, I'm assuming they can just call you or someone on your
They just
staff.
call
Yeah,
me, and we'll work through this. I mean, we have some plans of naming certain parts of the building, the
sure.
new building, the lab, the waiting area, the various rooms, so all that is in the process. So depending
Yeah.
on the donations, we will do all those things.
Right. Well, this is an exciting chapter for RCMS. It's ambitious, but it's also exciting. I feel it's forward-looking because you're thinking about the next generation of people who will live here. We're all, for better for worse, we're all aging. At least I am, Ara. You look like you're younger, but most of us are aging, and we need RCMS for a number of those services you talked about. But we'd like it also to be functioning at the highest level possible down the road in the future. And this is a big step towards doing that.
Right. No,
Uh,
absolutely. And if I may make one comment, and I kind of repeating myself a little bit, I don't believe, George, that this community of us, this such beautiful community in a stunningly beautiful place, will be the community if we don't have our CMS. If we
yeah,
don't have a comprehensive healthcare providing entity,
yeah,
we can't live here, right? And the realization, and that's based on economics mostly, there is no alternative possible of RCMS from scratch. No one can build it.
yeah,
Nothing is possible. We have tried everything. So
yeah,
given those two facts, we must do something so RCMS can live for next 15, 20 years so that
yeah,
the community can live here.
yeah.
And that's the
Well
bottom
put.
line.
Yeah, well put. So this isn't just because you'd like to have a new building. This is actually an imperative for the
Absolutely.
future, is what you're telling us. Ara,
Absolutely.
thanks so much for filling in our audience here on a challenging but exciting step for RCMS. I'm pretty sure we're going to be hearing from you and your folks and during the capital campaign, and we'll all be ready to step up to whatever degree we can. I'll keep my fingers crossed for some really large, generous donors to step up. Um, Folks, we have been listening to Ara Chakrabarti. Ara is the CEO of Redwood Coast Medical Services, and he's told us in the last 30 minutes about um, their plans for the future to grow and to be able to handle future needs and to make RCMS a much more comprehensive healthcare facility than it has been to get us ready. Ara, thank you so much for sharing all this with us.
Thank you, George, for giving me an opportunity. And as you said, I'm here. Anyone wants to talk to us from the community, please give me a call. And anytime you want me to come back to this show, I'm always available.
We'll do it as the capital campaign gets rolling. We'll have you back because we'll want
All
to hear
right.
an appeal. Well, you'll make an appeal for
Sure.
funds. We'll do that. Thanks so
Sure.
much, Ara. Take care.
Thank you. Bye-bye.